Good morning, everybody. It's June 1st, and things are looking good on this beautiful day. This is Dr. Christine Ebert Santos at Ebert Family Clinic with our weekly COVID in the Mountains update. And the good news is, new research shows that masks work. Masks prevent over 90% of the germ transmission and the particles that come out, whether you're talking, breathing, or running. However, the main risk for getting this infection is the amount of virus that you're exposed to. So if the mask holds in more than 90% of viral particles, and you stay at home when you're sick, because we can't really tell if you have COVID or the other viruses that are starting to come back and cause fevers in kids, then we can keep our community healthy. At Children's Hospital, they have been testing every child who comes in for elective surgery. These are healthy children, and they find that 2% of them are positive on the COVID PCR test, meaning that they do have active virus in their secretions. This is good news and bad news. It's a pretty small percent, but it still means that we could be exposed when we don't know it. And that's a reason why we want to wear masks whenever we're going to be within 6 feet of other people. Being outdoors, the normal flow of the air, even as we walk, does dissipate the viral particles, so the risk is very low. When you're walking, running, biking, you may not need to wear masks unless there are a lot of other people close by. Limit your face time with other people who are outside your bubble. With being face to face with somebody, talking for more than 10 or 15 minutes will increase your risk. In medical clinics like ours, we are doing a divided medical evaluation, so that we may do your interview on telehealth or over the phone to get your medical information and find out about any issues or problems you have, and then do a quick face-to-face that's 5 or 10 minutes where we listen to your heart or do a procedure or vaccination. So that will decrease any risk of transmission between patients and providers. I want you to check our blog, highaltitudehealth.com, because our last article was on the 4 ways that living in high altitude decreases our risk for severe COVID infection. The other update that I heard from Children's Hospital last week was the multi-organ inflammatory syndrome in children, which starts with fever and abdominal pain or diarrhea, rash, or other symptoms, and leads to shock. Does have a relatively slow onset, so parents have been calling me when their child has diarrhea or fever, and we had to consider whether that's an issue. And we do have 3 to 7 days before the onset of more severe symptoms, so we can watch those children. We don't have to rush into any intervention. They would not be testing positive on the COVID PCR because it's related to a previous exposure to COVID. Antigen testing may be indicated when we are seeing those children, but they would mostly be seen by specialists at Children's Hospital. I have not heard of any cases in our area. The other issue we talked about was travel. You should seriously schedule a 2-week quarantine time if you return from a trip and you've been around other people in other locations. You can look up on the websites which areas still have active COVID transmission so that you can avoid them or quarantine if you return from those. Now, how to party this summer. I'm going to use as an example Outer Range Brewery. They have a beautiful patio, and last year we enjoyed the outdoor music. We know that music transmits a lot more aerosols and up to 10 feet. So I'm going to suggest that we have our bands with instrumental music, or when they're going to sing, they could turn and face the mountains and sing into their microphones with their backs to the crowd, then turn around and wave at the crowd. The crowd, which will be people sitting with their family members in their bubbles, separated by 6 feet on this lovely patio. And I think we could still have a good time this summer. Thank you for visiting our Facebook site and staying up to date. Stay safe and have a great summer.